ConforMIS makes the patient's knee come alive. I think it constitutes exactly what you need to do and then give them their normal anatomy back again while implanting metal and plastic. I am very aware that patients may look good, feel good for a certain amount of time, but there are a small percentage, 15–20%, possibly more, that aren't happy with their knees. This is something I believe with a customization will satisfy that problem better than a conventional knee, because they are duplicating the curves and the anatomy of the knee joint and therefore making it much easier for the soft tissues to contend with the knee once it's in. In my experience with the ConforMIS custom knee, there has been less blood loss, less pain after surgery, and a faster recovery of flexion and independent activity. The physical therapists have noticed that the flexion is more easily attainable with less stress to the patient, and the patients have noticed this. They feel that they're recovering more quickly, particularly when they have a conventional knee on the opposite side. There you get a real comparison, and they tell me the second day, this has been a breeze compared to my other side. They go through their therapy and they're getting their flexion back, even in the hospital before they go home on the second day. They can tell the difference. They have expectations that after a total knee, especially the younger, more active people, that their knee is going to be fairly normal and be tolerant of anything they want to do, short of excessive, sports. I've been to every orthopedic company you can think of, and I have never seen implants created in this manner. It is a great deal of technology involved, and the accuracy that goes along with it. This impressed me to the point that I think the ConforMIS technology is making the knee more perfect to me and to a patient.